AAMG. Your choice, your health, our mission.
Welcome to AAMG YouTube channel. We're honored to have Dr. Kwok to come in and explain to us a very important topic. As we all know that during COVID-19, there's a lot of uncertainties. So we invited him to explain to us any specific function and the benefit of having the advance directive done earlier than later. Welcome, Dr. Kwok.
Right, thank you. It is recommended that all adults draw up an advance directive while they're still healthy and able to make sound decisions for themselves. There's no better time to do it when you are not under stress and not under pressure from dealing with illness. With the uncertainty during these unprecedented times from the COVID-19 pandemic, having an advance directive will be very beneficial. The pandemic has taught us that life is unpredictable and can change at any time. Seemingly healthy, able-bodied adults may unexpectedly end up in the ICU on life support due to COVID-19 infection. Patients who are on life support often will not be able to communicate their desires or have full mental abilities to make medical decisions. The advance directive may not cover all aspects of medical care, but will serve as a guide to healthcare providers to direct the care that is most compatible with the patient's values. Another important aspect of the advance directive is the DPOA, or the Durable Power of Attorney, who is a proxy, which is the designated decision maker for the patient. This person will help the patient make healthcare decisions with doctors while the patient is incapacitated. Without a designated decision maker, the care of the patient becomes suboptimal, as doctors will often have to discuss with multiple family members who may not all agree on how best to proceed. This typically causes delay in treatment, which may affect the outcome in some cases. Not having a DPOA will add additional pressure on family members who are already under tremendous stress from dealing with a sick loved one. In this way, having an advance directive is in the best interest of the patient and the family members.
So is it true that the patient can choose to do the entire version of advance directive, or do just the portion of choosing the decision maker alone? That would be okay as well, is that right?
Yeah, they can complete any portion. The different portions are, part of it is a living will, and the other part would be designating the durable power of attorney for healthcare. So the living will is sort of a list of instructions of care that the patient will want or not want, such as being placed on ventilators or life support or not. And then the decision maker, the DPOA, will help, because the list of instructions, the living will cannot possibly cover every decision possible. So it is good to designate someone to represent you when you can't speak for yourself. So that's what the other portion is. So some people may only want to complete one. Still, having one is better than having nothing. It still will be helpful in the care.
So were you able to share your professional or personal experience in patient care about the advance directive?
So although the advance directive is an important benefit for patients, the majority of adults do not have one. There are many barriers, including doctors not having enough time to meaningfully talk with patients during their clinical busy encounters, or patients not being receptive to discuss this emotionally sensitive topic. Patients also try to avoid committing to writing down their advance directives because they're afraid that they may change their mind later. Of course, it is important to know that advance directives only come to play when the patient is incapacitated. While they are conscious and clear-minded, patients continue to make their own medical decisions, and doctors do not defer to the advance directives. Moreover, advance directives can be changed by the patient at any time that he or she wishes. Often, we try to review their advance directives with them routinely to make sure that previous choices are still consistent with what they want. I recall doing an advanced directive with a patient once. This patient had a painful experience of being on life support in the past. So he knew very well that he did not want to repeat that experience again. As part of his advanced directive, he requested to be DNR, which means he did not want to be placed on a ventilator or be given life support if he became ill enough to need it. His decision caused a lot of disagreement among his family members, and emotional arguments ensued among them. Ultimately, it was the patient's choice and they had to accept his desire. Some months later, unfortunately, the patient got into an accident and he became gravely ill. His wishes for comfort care was able to be carried out as stated in his advanced directive, and his DPOA was able to clearly follow the decisions in agreement with his wishes. The family members who were unaccepting previously were also more prepared as they knew the patient's wishes, and also, although they were sad, they were comforted knowing this. If no advanced directive was in place, this patient would have suffered more and may have even received life support that he would not have wanted. Not to mention that there would have been tremendous burden on the decision makers. So advanced directive is an important tool designed to help patients and to ensure that the patient continues to receive the care that is consistent with their values and desires, even after they can no longer communicate with their healthcare providers.
That's wonderful. Thank you so much for your advice, Dr. Kwok.
Thank you.
Thank you for coming.
Thank you for watching this AAMG YouTube channel. If you have any questions or comments, feel free to leave the comment down below this video. We'll try to get to your questions or comments. Always remember, subscribe, like, and share this video to your friends and family so more people can be benefited. Thank you for your support.